In this video, we're going to take a look at the scapula. The scapula is technically part of the pectoral girdle, helping hold the upper limb to the body. Underneath the scapula on your note sheet, you're going to want to put anterior, lateral, and then posterior, just because we'll reference those. Some of the markings you'll see on multiple views, others will be exclusive to just one, and they'll be able to help you identify that specific view. So let's get into the bony markings. The scapula has kind of a triangular or blade shape to it, so it has three different borders. The superior border, as the name implies, is going to be higher than the other borders. So the superior border will be here. We'll talk about the superior border when we get into some muscles like the levator scapulae. The medial border, as the directional term implies, needs to be closer to the midline. This can be tricky because you need to visualize how the scapula is going to look on the body. So remember, you can always reference the standing skeletons in the classroom, but the medial border is going to be this long, plain border where there's no extra hooks. Okay, those hooks will be things that we'll talk about, and they'll eventually lead to the shoulder joint. So in the middle or towards the midline, there's really nothing other than muscle attachment. So we'll see muscles like the rhomboids and the trapezius have some connections to this area. I think of the medial border as somebody who's able to stick their shoulder blades out. If you can do this, or if you've seen somebody do it, that's the shape that you're getting. You can see that long kind of slightly curved border along the midline, so the midline going down the backs here. The lateral border then will be our last border, and it's going to complete the triangle shape by going up and out towards the armpit is what I think of it as. So remember, the armpit would be away from the midline, so the lateral border needs to lead up towards where your armpit is, and that's where your shoulder joint is going to be. So you can picture the humerus connecting here, not over here where it's flat. Okay, and when I look at it from the posterior view, again, I can picture it going up towards the armpit, and the humerus is going to attach here. This will be my long, boring, flat border towards the midline. Probably the most important marking on the scapula will be the scapular spine. It's going to help us determine the posterior view, because I think of it as a spine. When you think of your spine, what protects your spinal cord, it's on the posterior side of your body. Therefore, the scapular spine is also going to be on the posterior side of the body. We did see spine on the ischium. This one is similar in that it projects off of the bone, but it's significantly longer, and we're going to talk about how it has a kind of separate marking attached to it. So for scapular spine, know that this is your best indicator of the posterior view. We will see lots of muscles attached to this bony marking as well. Our next bony marking is going to introduce us to a new bony marking that will be very common on the upper limb. It's the fossa. So breaking apart the name will be important to understanding or helping you figure out where to look for this. Supra is going to indicate that it needs to be higher or above. Spinous is telling you that it has to be linked to that scapular spine. So spine is referencing the fact that it's the spine. Supra means that it's above. And then fossa is going to be something you could almost set your finger into. It's technically described as a shallow depression or a little trench, but I kind of think of it as something you could set your finger into. So this is the trench above the scapular spine is how the name would be broken apart. Because it's linked to the scapular spine, like we talked about on the last slide, it has to be on the posterior view. And we will see some muscles attach in here, like the supraspinatus. Okay, if we just said the supraspinous fossa was above the scapular spine, the infraspinous fossa is going to be below the scapular spine because it's referencing inferior. So it is lower than the scapular spine. And again, it's a little shallow depression that we're going to see a muscle attach into. So another posterior marking because spine is referenced in the name. The acromion is going to be a marking we can see on multiple views. The prefix acro means highest. Think of it as like the Acropolis. If you're somebody who loved Greek history, the Acropolis is a building in Greece that's on its highest point. I also think of it as like an acrobatic person. They'd be able to jump the highest or flip the highest. So the acromion is going to be the highest point. You can see it's higher than anything else on that scapula. And it also kind of has an A shape to it, especially on the posterior view. So I picture being able to draw kind of a angled capital A in the acromion. It's a continuation of the scapular spine, but it projects laterally, so it's going out towards the armpit. And it also projects slightly anteriorly, as we can see on this lateral view. This would be going up towards the front of your body. The purpose of the acromion is to stabilize the shoulder joint. So again, we'll see the head of the humerus articulate right here, and you can see that the acromion will help stabilize that arm bone. The glenoid cavity is also visible on multiple views. Think of it as a cavity in your tooth. It's a little depression in there, but it's not a full passageway necessarily like a foramen would be. The glenoid cavity is best described as the socket for the ball and socket joint at the shoulder. So this is going to be the articulation site for the humerus like I drew before. The humerus's head will sit here. So the glenoid cavity always has to point laterally. Just like the acetabulum on the coxal bone, this is going to be your best indicator that this has to be the lateral view. The coracoid process works with the acromion to help stabilize the shoulder joint. So it's going to be the other hook type of piece here. Coracoid technically means raven-like. So early anatomists looked at this projection. That process is going to be another one that is pretty common here. Process needs to poke off or stick away from the bone. So they thought that this piece that sticks off looks similar to a raven's beak. You can distinguish it because it's more beak-like, and again, it's not as high because acromion meant that it's the highest point. I also think of it as the girl's name Cora. When we get lower on the arm, we're going to see a coronoid process. So very similar in spelling, but two different projections. And I think of tapping Cora on the shoulder. So you might tap a girl named Cora up on that coracoid process just above the shoulder joint. Next, we're on to our last fossa of the scapula. So again, fossa is very common on the scapula. This time, when I look at the name, it's subscapular. Sub means that it's like under, lower, sometimes like within, and then the scapula. What you notice is that there's no spine reference. So because there's no reference to spine in the name, it must be anterior. Remember, the scapular spine was the posterior marking, and since this fossa does not reference spine, it has to be on the anterior view. So this is a great thing to indicate that you're looking at the anterior view. It also makes sense because this is the surface that would be closest to your ribs. So you don't want any extra projections in this area. Instead, you want this large kind of scooped out portion that would allow for easy movement around the ribs. And lastly, we have the body. The body really just references the entire blade-like part of the shoulder blade. I won't often reference it. When I do, I'll usually try to put it down towards the point of the scapula, just so you don't confuse it with one of the fossas like the infraspinatus or the subscapular fossa. Those are your markings of the scapula.